what are her chances to get pregnant?
Normally for hormone receptor positive breast cancer, when they relapse, normally it goes to the bone first before it goes to other areas.
We must also understand that nowadays, many of the side effects we can actually either prevent or treat.
Welcome to this 4th episode of Hormone Positive Health Chat series as we discuss the treatment concerns in early stage hormone positive. Check out the previous episodes on Talk Health Asia's YouTube channel and remember to subscribe.
I think some of our audience was wondering what it means to be a high-risk patient. If you can just touch on the adjuvant treatment for high-risk ladies and what are the features of high-risk ladies, just briefly.
Okay, so those who are at high risk of relapse, they generally have larger cancers or essentially higher stage. So stage 3 breast cancers are considered high-risk breast cancers, means large, many lymph nodes involved. Yeah, and then there are patients that are also stage 2 that are lymph node positive. Now this is a little bit more gray. They are gray here because we know that these genomic tests can sometimes tell us that even if the lymph node is positive, they can still be lower risk. Now, but if we look at certain ER/PR and HER2 patterns, we can also tell if someone is high risk. Like if someone is the ER is low, the PR is negative, the grade is 3, then we will also consider those patients high risk. And lastly, if the genomic test or the gene test of the cancer comes back telling us this is high risk of relapse, then these patients, we really need to do more for them to give them a better chance of beating the breast cancer.
And what's doing more? What does that look like?
Okay, so when we say doing more, okay, that would involve chemotherapy, unfortunately. Okay, and it will usually also involve radiotherapy, especially for those with lymph node positive breast cancer. Anti-hormones wise, we will need to actually give the very best anti-hormone treatments, and they're usually aromatase inhibitors. Okay, but we must be mindful that these can only be given to women who are postmenopausal. If the woman is premenopausal, then we need to talk to her about menopausal treatments by shutting down the ovaries, by stopping the ovaries from producing the estrogen that feeds the breast cancer cells. Now, for these women, we can either do anti-hormone injections, okay, or for some women, they prefer to have surgery to remove the ovaries. Yeah. And lastly, is actually the use of targeted therapy. So I mentioned earlier the use of CDK4/6 inhibitors. Okay. But in patients with BRCA mutations, we would generally use a PARP inhibitor. So a targeted therapy that is only useful for BRCA positive patients.
I see. So, with all these treatments that we are talking about, what are the trade-offs? What are the side effects that our patients need to be aware of?
Yeah, so that is something that I think everyone is afraid of. Even us as oncologists, we are also takut lah, with the side effects that we may actually put our patients through. Yeah. So in terms of the more treatments that we give, okay, the more side effects that we have to deal with, unfortunately. Yeah. In terms of chemotherapy, common side effects, people can lose their hair. Okay. There are issues with the blood counts, issues with the gastrointestinal system, like nausea, vomiting, mouth ulcers, appetite, problems, taste change, constipation, feeling tired, numbness in the hands and feet. Okay, these are the common things, but we must also understand that nowadays many of the side effects we can actually either prevent or treat. Yeah. So for women who are listening here, don't be so scared. If you need to have chemotherapy to give you the best chance of beating the breast cancer, then let's do it. But we walk you through it. Okay, we journey this with you. So as an example, nausea and vomiting from chemotherapy is not that common anymore because the anti-nauseas that we have now are really good. Okay. For more side effects, like let's say if someone has constipation, we can use laxatives. Someone who has mouth ulcers, we can use mouth ulcer medications. And we mustn't also forget exercise. Yeah. So exercise is one of the best treatments to reduce the risk of side effects. So it's been shown to reduce the risk of numbness in the hands and feet. It also we also know that patients who exercise have a higher chance of actually completing their chemotherapy. The blood counts can also potentially be better as well. So even with these side effects, I ask you to not be discouraged. Work with your oncologist. The other side effect that we need to think about treatment-wise is from the anti-hormones. Yeah. So these are the ones that I suppose are a bit more troubling because anti-hormones are given over a longer period of time. Because for chemo, there is, you finish off that, that 4.5 months or 6 months or, of treatment, and then you're done. And then you spend the next, few months recovering, from the chemotherapy. But for anti-hormones, we have to be mindful that women are taking these medicines in the long term, like 5 years or 10 years. Now, the side effects are generally akin to menopausal symptoms or low estrogen states. So like hot flashes, body aches, feeling stiff in the body, being a bit more emotional, tired, vaginal dryness, and trouble with sex. The bones can also be softer, okay? But these can vary from woman to woman, especially by age, yeah? So younger women tend to experience more of these sort of low hormone state side effects compared to older women. And also the type of treatment that we give, right? Okay. So AIs or aromatase inhibitors generally have more muscle joint kind of problems that we need to tackle. And also how long we give these treatments for. So the more intensive the treatments that we give, yes, the more hormone-related side effects. But again, there are also many studies that have shown that exercise, again, actually does help with many of the hormone-related side effects, especially the muscle and joint stiffness and all that. So, we mustn't forget that. And, we don't, when patients ask me what supplements can I take to reduce all these side effects, I say no need supplements. Exercise, it's free of charge. No need to pay money for it.
I'm a big fitness buff, so I absolutely support that advice. I'm going to bring up the topic that a lot of Malaysians love to talk about. We love to talk about food because we love eating food. So I think if I may invite Dr. Kiley to just maybe do some myth busting here. So what kind of food should our patients be taking?
So generally, I think, we need to understand that, we shouldn't really do prescriptive kind of diets. Yeah. So when I say prescriptive diets, sometimes, I have women coming to see me, you must take this number of fruits, this amount of vegetables, you must avoid this, and avoid that, and then you'll be fine. Now, so in terms of diet, it's usually a way of life, If you really want to follow an anti-cancer diet, it's actually quite simple. It's a diet that's actually rich, in fruits and vegetables, good types of carbs, grains, legumes, less processed foods. And we also try to minimize alcohol as well, because alcohol has been shown to be carcinogenic, and even at low amounts. So I don't usually prescribe a diet for patients. And I think most of us will know that the diet that I mentioned is pretty self-explanatory. It seems natural that is the right thing to do. But there's a lot of myth in terms of what you cannot eat, what you can eat. Or when I say you can have the occasional durian, it's fine. They say, really? I can eat durian? My friends say they eat durian, the cancer come back. So no we are Malaysian, we have really good durians. We need to enjoy our durians, right? Okay.
Are you? You're doing an advert for durians here. Also,
yeah, because sometimes they are so women are just so crippled with fear. They go out with their family, they eat their own diet, and then the family eats their own diet. So she packs her food to the restaurant.
Oh gosh,
and her family then has the food in a restaurant. So I'm just trying to just debunk some of these myths.
One of the question was from our listener. She's a young breast cancer survivor, and she was diagnosed with breast cancer ER positive when she was 32. She's now completed all treatments. So what are her chances to get pregnant? So can I just address that to Dr. Kiley?
So thanks. So this is a common question, especially for younger women who have had breast cancer, but then now you come to a stage where you want to start a family. So the chances of having a baby after treatment will depend on a few things. So firstly, whether you've had chemotherapy in the past, whether you have your periods back or not. Okay, so generally, if your periods have returned, okay, you have a decent chance of being pregnant. Okay, also if you start a family younger. So if you wait until you are 40 years old and then you want to try for a baby, then of course the chances will be lower. Very important also for the woman asking is having a baby safe after breast cancer? So the answer is yes. Okay, so we have seen many studies that shown that women who go on to have children after breast cancer actually don't do worse, and in fact some studies even suggest that they do better. Yeah. And most recently also we've had some studies, a pivotal study which showed that stopping anti-hormones after 2 years of having the treatment to start a family appears to be safe. Yeah. So to answer the question on a whole is yes, if you want to have a baby, please go on and do that. And that's a very important part of a woman's life. Yeah.
Thank you. I think that's very reassuring. Also for the woman to know that they can still fulfill that wish if that's in their life plan. So Dr. Saladina, I thought I'll bring you in now. If we sort of change our perspective from early breast cancer going to a breast cancer that's spread to other parts of the body. As a patient going through the journey, how would you experience a cancer relapse, and what can that look like or feel like to these ladies?
In hormone receptor positive breast cancer, the relapse occurs normally later in their journey, not as the TNBC or HER2 positive, where the relapse risk is highest in the first 3 years. But for hormone receptor breast cancer, they normally relapse much later, beyond 5 years, 10 years. So they can actually present with symptoms of pain, bone pains. And normally for hormone receptor positive breast cancer, when they relapse, normally it goes to the bone first before it goes to other areas. But it can present them as lung metastasis or liver metastasis, but more often it's actually in the bone first. So during follow-ups, apart from examining the chest wall, examining the operated breast, you assess the axilla, you ask symptoms of possible distant metastasis like bone pain, feeling bloatedness. Sometimes when they have a liver metastasis, they can have this a distension feeling in the tummy, and of course you don't want to wait for them to have obvious jaundice before you investigate. So when the patient has symptoms that may suggest a possible relapse, then we have to investigate on these symptoms. Some patients, when they come with these specific complaints, and if it's persistently saying, despite all that remedies, is still having very persistent shoulder ache, then you should actually investigate. And we can investigate by doing a bone scan or a CT scan or a PET scan. Simple thing like cough, they have dry chronic cough, and they're not having any respiratory infection, but they're still persistently having this dry irritating cough. You need to consider possibility of lung metastasis. Simple chest radiograph to see whether there's anything that warrants a further test like a CT scan of the thorax is often what we will do in the clinic.
Thank you. I mean, I think same like you, the important take-home message is really to be body aware. So for our patients to listen to their body and listen to the complaints that are consistent and persistent. And that's when you really want to raise it up to see why that's the case. I would like to introduce to you talkhealthasia.com, which is a website full of medical information where you can get YouTube videos to understand health issues. So not just cancer related, it's targeted for patient as well as caregivers, and they're really in a format which is easy to understand for our local population. Breast cancer that's already spread to other parts of the body. Now, is it curable?
We have bleeding tumors, which you cannot control with chemotherapy alone.
It is important to know that they are generally covered by most insurance companies, the good ones.
Subscribe to Talk Health Asia's YouTube channel for more health chats episodes, or find easy to understand health videos on talkhealthasia.com.